Hey guys, and welcome back to this segment on our channel called Answering Your Most Googled Medical Questions by Hada Gastro, and today's video is a super interesting one. So let's get started. So in today's video, we'll explore the question, what are the long-term effects on survivors with COVID-19? So mild or moderate COVID-19 lasts about 2 weeks for most people, but others experience lingering health problems even when they have recovered from the acute phase of the illness. In such patients, there is no longer live coronavirus running amok in their body, and if tested, the person would test negative for the coronavirus, but they might still be severely debilitated nonetheless. So while it's clear that people with certain risk factors, including high blood pressure, smoking, diabetes, obesity, and other conditions, are more likely to have a serious bout of COVID-19, there isn't a clear link between these risk factors and long-term problems. These people sometimes describe themselves as long haulers, and the conditions that have been called post-COVID-19 syndrome or long COVID-19. So SARS-CoV-2 may attack the body in a range of ways, causing damage to the lungs, heart, nervous system, kidneys, liver, and other organs. In some individuals, mental health problems may also ensue from grief and loss, unresolved pain or fatigue, or from post-traumatic stress disorder after treatment in the COVID intensive care unit. So now let's dive in and explore 7 complications that may affect the patient after they've completely recovered from a COVID-19 infection. So number 1 is breathing complications. So studies have shown that a bad case of COVID-19 can produce scarring and other permanent problems in the lungs, and even mild infections that can cause persistent shortness of breath and dyspnea, which is difficulty in breathing in some patients. Number 2 is heart problems. So SARS-CoV-2 infection can leave some people with heart problems, including inflammation of the heart muscle, which is medically known as myocarditis. Various studies have also shown that individuals who have recovered from COVID-19 had signs of ongoing heart inflammation, which could lead to common symptoms such as shortness of breath, heart palpitations, and a rapid heartbeat, which is called tachycardia. Number 3 is blood clots and blood vessel problems from COVID-19. So COVID-19 can make blood cells more likely to clump up and form clots. While large clots can cause heart attacks and strokes, much of the heart damage caused by COVID-19 is believed to stem from very small clots that block tiny blood vessels called capillaries in the heart muscle. Other parts of the body affected by blood clots include the lungs, legs, liver, and kidneys. COVID-19 can also weaken blood vessels and can cause them to leak, which contributes to potentially long-lasting problems with the liver and kidneys as well. Number 4 is a lost or distorted sense of smell and taste. So the senses of smell and taste are related, and because the coronavirus can affect the cells in the nose, having COVID-19 can result in altered or lost senses of smell or taste. Before and after people become ill with COVID-19, they might lose their sense of smell or taste entirely, or find that familiar things smell or taste bad, strange, or different. From about a quarter of the people with COVID-19 who have had one or both of these symptoms, the problem resolves in a couple of weeks, but for most, these symptoms persist. Though not life-threatening, prolonged distortion of the senses can be devastating and can lead to a lack of appetite, anxiety, and depression. Number 5 is problems with mood and fatigue. So people who have severe symptoms of COVID-19 often have to be treated in hospital intensive care units with mechanical assistance such as ventilators to breathe. Simply surviving this experience can make a person more likely to later develop post-traumatic stress syndrome, depression, and anxiety, especially if it's coupled with the loss of a close loved one. Number 6 is neurological involvement. So the most common neurological symptoms after COVID-19 infections are ageusia, which is total loss of the sense of taste, anosmia, which is the inability or decreased ability to smell, headache, nausea, vomiting, dizziness, and myalgia. Guillain-Barré syndrome, or GBS, has also been reported in a few patients but remains a rare manifestation of severe acute respiratory syndrome. The aforementioned neurological manifestations of the SARS-CoV-2 infection occur with the onset of respiratory symptoms and may be due to direct invasion of the nervous system by the virus, whereas in cases of GBS in COVID-19 patients, it follows a time lag of 1 to 4 weeks and may be attributable to the immune mechanism of molecular mimicry. And finally, number 7, which is persistent cough. So cough can persist for weeks or months after a SARS-CoV-2 infection, and it is often accompanied by chronic fatigue, cognitive impairment, dyspnea, which means a difficulty in breathing, or pain, a collection of long-term effects referred to as the post-COVID syndrome or long COVID. Over time, a cough can develop into a cycle where excessive coughing causes irritation and inflammation, which worsens the lung tissue, leading to even more coughing over time. And that brings us to the end of this video. Thank you guys so much for watching. Hope you found the presentation very interesting and informative. Please make sure to like, comment, subscribe, and share. And please make sure you turn on your bell notification so you'll be notified every time we have a new upload. If you would like to help us make better videos and content, you can also donate to us via PayPal. Take care, and thanks for joining me today as I explored the long-term effects on survivors with COVID-19.